Pressure ulcers are unfortunately common, but we've known for a long time that they're largely preventable. I remember when I was training, I had a registrar from Zimbabwe, and we had a patient who developed a pressure ulcer, and he said, in Zimbabwe we would not have tolerated this is a failure of care. So what we're doing in preventing pressure ulcers is preventing failures of care that cause a very devastating illness where skin breaks down and people end up with a chronic, painful ulcer with a risk of infection that can be life-threatening, and with a huge cost to them in terms of the amount of health care they need to receive, the amount of time they spend in hospital, and the cost to the system. So previously we've run a campaign as part of the 1,000 Lives Improvement Service in 2008 and onwards to look at how we try and avoid pressure ulcers, particularly in hospital. And we have a bundle of care around movement and the surface people are lying on, and looking at nutrition and incontinence, etc., and examining their skin to make sure we prevent as many of these as possible. We're also supporting the global campaign Awareness Day on the 19th of November to try and move forward. And we know a lot more about pressure ulcer prevention even now than we did 5 years ago. We want to work across the system, not just in hospitals where the main focus of care has been, but we're aware we need to work in the community settings and particularly around care homes to try and make sure that there is good care and prevention of pressure ulcers in those settings as well.